Like any good relationship, it starts with, hey, we have a common interest and a common goal, and let's get to some place where we can all agree. Health policy, doing it in the microcosm that is the Hill, is really, really hard. As we see today in the media, people want to talk past each other. You have to really stop and reflect and think, okay, how do I listen to that person? Is there areas of agreement? Oftentimes you have to say, we're going to have to agree to disagree and put that aside for the time being, and let's focus on where we can agree. And so we were fortunate enough, and I think Melanie, her past work at GAO, really, that was the linchpin for us to say, hey, you've done some outstanding work in your professional capacity before coming to the Hill. Let's work on that, see if we can find common ground. And fortunately, we were.
I think about it, it's also going beyond talking points. If we just stopped talking to each other based on the bullet points of our two positions or the positions of our bosses or our parties, we weren't going to actually do the policy work of getting to the details and seeing where there was commonality. I think over time, I could often preemptively know where the pain points were going to be in our conversations, know where Brian's perspective and the perspective of the Republican Party was going to not be in alignment with my perspective or the perspective of the Democratic Party. And if you walk in saying, okay, I know we're going to have tension and friction here, but where else can we get to agreement? What are the challenges we see to make the system better? It allows and I think we also were both willing to compromise. Mm-hmm. We knew where the bright lines were and what we couldn't compromise on. But those were really few and far between.